Hi, my name is Colleen. I am a first year doctorate in psychology student at Adler University. I'm doing my social justice practicum at Mindfulness-Based Somatic Therapy. And yeah, I'm just here to interview someone who's had experience with this. So, Jenny, would you mind introducing yourself?
Sure. Thanks, Colleen. Thanks for inviting me to speak with you today. My name is Jenny Lorca. I am a palliative care registered nurse, and I'm a mindfulness-based somatic therapy practitioner. Um, so my, and you were wanting to know how I got involved or how it sort of
Yeah.
fell into my lap.
Yeah. What's your connection with mindfulness-based somatic therapy?
Yeah. So at the beginning of January of last year, I was like I said, I'm a palliative care nurse. I'm working in a hospice, and um, the end of January of last year, I was diagnosed quite acutely with a, a chronic illness, rheumatoid arthritis, and uh, and it was quite debilitating. I had to immediately stop work. Had significant pain, significant mobility issues, and on top of all the trauma that comes with a chronic illness or any sort of major diagnosis that impacts one's life, I I can honestly say I'm quite resourceful, so that I mobilized my resources. I sought my, I created a created a functional healthcare, a holistic and healthcare team of like naturopath and GP and my rheumatologist and a chiro and a massage therapist. And when it was time to see a counselor, and I have seen counselors before, like I would never have gone through nursing school without my counselor. Um, but when it was time to when I was looking to find a counselor that would speak to me and my my current self, um, I recognized that, um, and this being said, my experience with counselors has been all talk therapy. So, in my current state, in my new normal, as I was calling it, I needed somebody who would get me out of my head and into my body, because I'm sure, like many whom I have worked with, living with mostly cancer, many chronic and severe life-limiting illnesses, um, living with a chronic condition, it for me, it divorced me from my body. I felt betrayed by it. I felt like I had, sort of ripped my physical body away from me and just tossed it in a corner and said, that's a bad girl kind of thing. And I, knowing that I needed to find something that would help me reconcile those pieces, because I was so angry. I was so angry.
Mhm.
So when I looked for a counselor who would seek that would fit those needs, I ended up coming across Ratan Psychology Today, and she had advertised yoga therapy as part of what she offered. And I thought, okay, well, and I didn't know what mindfulness-based somatic therapy was. I mean, I knew what mindfulness was. I know what somatic therapy is in terms of like soma relating to the body, but I had no idea what this was.
Mhm.
Um, so I jumped in, and the first session um, was transformative in that it over the course of several sessions, it unlocked a lot of that that emotion that, when you think of when you think of emotions being caught and trapped in your body without any sort of avenue to let them out, like what that impact, like how that impacts you, and how even living with chronic pain, chronic fatigue, chronic everything at that point. I felt like how much more like having those locked in emotions compounds everything. And so at the time I was walking with a cane, and sometimes walking with two canes. It was just enough for me to drive to see her. And um, yeah, and it like I within the first session, I had this major release of emotion that had been trapped in my body, and also of certain, like, I'm a nurse. It's vicarious trauma is kind of one of the compassion fatigue, burnout. Those are all workplace hazards, and especially in end of life care. And this is pre-COVID, right? So I have no idea who I was carrying with me, what I was carrying with me on top of my own stuff. Um, I almost swore there. But it, the yeah, the sense of release has been immense, was immense. And interestingly enough, so I have a background pre nursing. I have a background in theater. And actually what I loved about MBST was that it was very much like theater. The use of voice, the use of that was encouraged, the use of breath, the use of movement, which is so unlike my own um, assumptions and perceptions of what counseling is, which was sitting down, being nice, talking about my feelings and trying to process them cognitively. No, it was totally the opposite. We barely talked. And you know, there were I could just feel it in my face. Like I felt like there was more space in me because whatever was has been locked in there was released. And because it was reminiscent of the theater training that I had undergone, I embraced it. um, I mean, it I can see where exploring something as deeply intimate and vulnerable as being in touch with our own bodies can be quite intimidating for many people. I think because of my theater background, it was one of those things that just really fit. So, in terms of like, I noticed I was feeling less pain, especially after a session. I would walk in with a cane, I would hobble in with a cane, and I would walk out without it. And
Wow.
that's significant,
Yeah.
significant. Um, and I didn't see her like I can't even remember how many sessions I had, but they were all so profound, right? And at the end of my last session with her, I felt complete for now, in that, okay, I think I have everything that I need for now to continue the work on my own, whatever that is. And it was a marvel, Colleen. It was, like I said, it was transformative. It was freeing, especially when I said, especially when I felt like I was locked in. Um, so that's sort of part one of my MBST story. And then I started to really think about, and as I am now a member of the chronic pain, chronic illness community, I, you know, as time went on last year, I started to be involved with Pain BC, who work with people in BC with chronic pain. And I'm a volunteer there on a couple of their programs.
Mhm.
Um, I I realized what immense potential for me it was, and what immense potential it could have for people living with chronic pain, and in people like you know, I'm always really mindful of, especially when I'm working, of the impact of life-limiting and terminal illness is on our patients, on their families, and on their informal and formal caregivers like their healthcare team. And all I could think of, my God, what amazing potential this has. I know my colleagues have so much carry. If I'm carrying this, I can't imagine how many more of my cherished colleagues are carrying this. I can't imagine what it must be like to live as the wife of somebody who has 3 kids and is 54 and is dying with lung cancer. I can't imagine what it must be like to, you know, to going back to be that gentleman at 54, being first diagnosed and then going through that journey. What could, what happened, or what would it be like if somewhere this was offered somewhere safely, obviously, right, to
Mhm.
their capacity, but you know, how would that change, how would that change their healing story? So um, I took the training, um, the level 1, level 2 training at, I want to say fall of last, yeah, this time last year I took the level 1, level 2 training, and
Mhm.
I was still in a place of pain and disability,
Mhm.
really. So it was my experience of, um, I think I was quite unique in that I came to the MBST training as a person who sought for services, and then who was so inspired by the effect and the impact that it had on me that I wanted to share it with the rest of the world, particularly the communities that I, you know, and feel so that I'm involved with and I'm a member of and feel so passionately about. So um, so like I said, at the time I took the training in a pain body, and you know, absorb, it was good, it was good for what it was at the time for me. And then when she offered it, and um as time went on, Rata and I started to develop more of a collegial relationship, because I think I'm like, from a clinical perspective, I'm like, what about this? And the physiology of pain, and then, and this is so interesting because this would, um, this, because I think I was obviously I was looking at it from my lens, right? From a lens of somebody who is a clinician, who is who has worked with people at the end of their lives, um, who lives with chronic pain and chronic illness. And so I think we were both quite intrigued with each other in that respect, that, um, you know, it just seemed like a good meeting of minds and hearts and souls. So as since then, I have been more involved. Like, she and I have been more communication. I retook the training recently, the level 1, level 2 training, and I mean, it just enhanced everything. And again, being somebody who sought their services, I have a real unique, like I said, perspective on what the impact this has, that could have, that will have, on people who who not only seek the service, but who also practice it, because it is transformative on both ends, right? It's very much a reciprocal relationship, in that, um, you know, as the practitioner, as the facilitator, you, the person whom you are serving is both the healer and the healee, right? So it, like, what it, yeah, yeah. And having that power like, having that power imbalance rebalanced is so fascinating, and I love it. So I don't know if I finished that story yet. I'm still like, as my as and it has kind of, what's that word? What's that? Jump? No, no. Oh my goodness, swimming pool, diving board. What's, oh my gosh, Colleen.
Um,
Right? I can't think of anything but jump start and a trampoline. Anyway, but it has springboard, for goodness sakes,
there we
Jenna.
go. I didn't know where to help you
Oh,
there.
you guys. Since
So
then, I've been,
it's springboard your or springboarded your journey.
yeah, yeah. And so since then, I've been, slowly learning about the somatic masters, right? Peter Levine, Bessel van der Kolk, and more like mindfulness, like learning more about mindfulness, learning more about the movement aspects, really revisiting my theater roots,
Mhm.
um, and just thinking about like the things that didn't make sense 25 years ago that make sense now when I was now in the middle of it. Um, on top of that, I I was on long-term disability this whole time, and very recently I went back to work, and it was it became pretty clear that I couldn't go back to the bedside nursing, the palliative care bedside nursing that I loved and have loved for, gosh, almost over a dozen years now. And, just like small things, from drawing meds, like the fine motor skills, and doing dressing changes, to like sometimes I have the craziest brain fog and it's not safe for me to drive anywhere. And so, how could I make those kinds of, clinical decisions when I've got 10 patients, 10 patients and a team members dependent on me. Um, so I couldn't go back to nursing, which broke my heart. It still does. And I'm still
Mhm.
grieving it and processing that. Um, Around that time, or actually over the last few years, I've had a lot of people say, you should go into counseling. You should go into, what about counseling? I think you'd be a great counselor. Yeah, what about counseling? Oh my goodness, you're such a great counselor. Like those, you know, and I'm like, yeah, 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 yeah. And now with, my new normal of um, uh, living with this weird and wacky body that I am beginning to love again. And this like a deep interest and deep passion, the same kind of passion that I have for palliative care, that is what is starting to really, um, it's churning and developing for me, like that same kind of like deep interest and aliveness, um, for MBST. And um, so now I'm kind of going, as I said, bass backwards, or bottom up, really. I'm going bottom up, um, from uh, to studying counseling
Mhm.
very soon. So
Wow.
that's, and that only took a half hour to tell.
It's quite the story though. You started with, seeking out your own, this wasn't just this didn't start as a career journey for you. This started as
Yeah.
a kind of last hope to try and work through some of the pieces when you got
Yeah.
this chronic diagnosis. And you noticed results within the first session,
Mhm.
and then kept going and getting similar results, and then taking the training yourself so you could share your experience that you had with others. And yeah, it's very interesting how everything worked out and the story that you had with it.
Yeah.
Yeah.
Yeah. I mean, and now again, like I said, my relationship with Rata has developed from has also gone the circuitous or almost even full circle route where before she was the person whom I was seeking help from to uh, a colleague and mentor, right? So I can't get enough of this work. Like um, I will assist in facilitating the next level one, level two group, and I love it because again, um, you know, to to be able to share or to be able um, to be able to have a lived experience of the therapy that you're learning
Mhm.
and be able to share that with your cohort is, I mean, it's a gift on both ends, right? It's not just, me being pedagogical and saying like, this is my experience and therefore you should listen to me, but it's more like, you know, if this happened to me, imagine what if you gave yourself over to this? What if because it does require a great deal of listening and
Mhm.
a great deal of vulnerability and a great deal of authenticity.
Mhm.
So, yeah, and I, yeah, I'm really excited. I'm really excited for this whole new journey to the point where I can say that having RA has been like probably one of the most important, and fibromyalgia. I was also diagnosed with fibromyalgia. So having these two chronic conditions have been probably the most important gifts that um, I have been given. So,
Wow.
yeah, yeah,
Wow, what an amazing perspective. You know, you went from having so much anger that this happened to you and having the pain and having this experience to being able to transform that view to this has been a gift to me.
yeah,
That no, that's so I don't even I'm speechless. I mean, it's that's huge. That's
yeah.
huge.
Well,
And
don't
how
get me. Sorry, go on. You're
Oh
gonna
no,
say,
I was just going to say like how amazing it is that you're able to share your story with people and share it. You know, I'm living proof that this can help you and that you can help people with this.
yeah, yeah. And I mean, don't get me wrong. Like, I'm still really angry sometimes, and still grieving,
Yeah.
and still like, my God, like the losses, and it keeps me like when I started having the experience of pain, like acute and chronic pain, it was one of those, oh my God, I get it now. I get it. This is what my patients go through. I,
Mhm.
you know, and I would say that you don't get it until you get it. And many people in the chronic pain, chronic illness community are like, yeah, exactly. That's exactly it. You don't get it until you get it. And so I mean, yeah, it has like, and I say it hasn't been the best. It's not my favorite gift, that's for sure, but it's been the most important.
Yeah.
Yeah.
Yeah. Wow. Wow. Well, thank you so much for sharing your story. It was very eye-opening, and I'm sure a lot of people will appreciate hearing about it. And yeah, I really appreciate your perspective and hearing where this diagnosis of chronic illness has brought you and some of the healing that you were able to get as a result of the mindfulness-based somatic therapy as well.
Mhm.
That's yeah, thank you so much for sharing that.
Yeah.